Okay, good morning, everyone. It's the 18th of August. Thanks for joining me this morning. And apologies, I was away last week on annual leave. I hope everyone had a good week. So the updates this morning, I just wanted to give you some updates on services. So audiology has restarted. And that's restarted for earwax removal, and it's restarted for all audiology and including home visiting service. They will be reprioritising the patients in the backlog, and that's restarted formally from yesterday, so you can start referring back in. The requirement from primary care, if you're going to refer someone from earwax removal, is that they've had a trial of olive oil drops and sodium bicarbonate drops. Olive oil, we recommend 2 weeks BD and bicarbonate BD for 1 week, and then refer in if that's failed. You don't need to do any kind of wax removal in primary care. The next thing is that there's the resumption of the surgical termination of pregnancies at the Royal Free, which was suspended across all Royal Free sites, which has restarted now. And they'll be seen at the Royal Free, and the procedure will actually take place at Chase Farm Hospital with infection control measures. So that's surgical termination of pregnancy. The next thing is August bank holiday. Just to confirm that NHS England has confirmed that they do not anticipate primary care cover is required, and usual bank holiday cover will suffice. So that means for us in Barnet, Barndock will cover bank holiday August for us as per our local arrangements. The next thing I wanted to let you know about is face coverings or face masks. So the government, along with Public Health England, have released a statement to confirm that patients and staff should wear a face covering in primary care. And there was an updated SOP for general practice published last, I think, Thursday before, which makes clear that NHS England expects all patients who are able to do so to follow government advice that patients should wear a face mask or face covering on primary care premises. So for a small number of patients who may not follow this guidance, then NHS England says that they're really ready to support us, ensuring that we take all reasonable steps to identify practical working solutions to avoid risks, and that we should actually offer patients a mask if they didn't come with one, and we should sort of try and insist that they wear a face covering or mask unless there's a legitimate medical reason why they can't wear a face mask in the practice. And I think the same goes for staff. So if staff members are not able to socially distance, so for example, in my practice, we encourage staff to wear face coverings when they're going in communal areas like corridors, going to the washroom, coffee areas, things like that. And that's now in the SOP itself. The next thing I wanted to talk to you about, which has come up quite a lot actually, is about intimate examinations during COVID in primary care. So obviously, as we know, it's brought new ways of working with remote consultations, and this is probably likely to dominate us in primary care for the next few months. Now, the GMC has produced clear guidance on the use of chaperones for intimate examinations, and the chaperone, as we know, has two roles, and that's to ensure privacy and dignity of the patient, and also to protect us as the medical professional. So there's no fixed definition of what no fixed definition of what an intimate examination consists of, but the perception of what an intimate examination is the key thing. So that's really where somebody, you may have, concerns regarding privacy, the security at the time, or an examination that the patient would be normally used to. That will be reviewed as an intimate examination. So what's really important is prior to the appointment, we make sure that there's a chaperone present at the time we're booking patients in, because now it's not kind of we're booking patients are coming in at 10 past 12, 20 past 12. They're coming in for a fixed appointment, which we've given them after we've triaged them on the phone usually. So it's important that we have a chaperone ready if we know that examination is going to be intimate, and that we've actually consented that patient on the phone that they're going to come in for an intimate examination. A chaperone will be present. Now, what the guidance is clear in saying, the new guidance really, is that if you are doing a remote examination, so one on sort of Accurex video, you should have a chaperone in the same room as you and make sure you're not interrupted. So it's actually fully legal to do an intimate examination on a video consultation, as long as the consultation is not being recorded, the patient is above the age of 18, they've consented, you've got a chaperone present, and there's nobody else in the room, and it's absolutely necessary. And what's really important is that the images are not stored, the patient's aware of that, and the examination is quick and timely. So there's some really clear information about that, because there was confusion about whether we could do intimate examinations on video consultations, but there's new guidance that absolutely says you can, but they must have these strict rules. I think the other thing is to be aware of technological glitches, which are frequent when we're working remotely. So the other guidance is that if a chaperone is not in the room with the doctor, so let's say you're logging on from home and working, that poses some issues, and there's some guidance on that available through the RCGP, but it's probably not the ideal thing and probably not recommended to be doing those examinations when you're not physically based in the practice. So that's quite interesting and something to be aware of as well when doing examinations. The next thing I wanted to talk to you about was, I'm going to share my screen with you in a moment. Hopefully you'll be able to see that in a few moments. Hopefully you can see my screen this morning here. So I wanted to talk to you about this slide here, which I'll share with you, which is a BMJ slide on the long COVID in primary care. Now, this is really about assessing and initially managing patients with continuing symptoms and what to do when they've had COVID. Because often we are seeing these patients in primary care, and I've had a few patients that have come in with ongoing breathlessness post-COVID, chest pain, fatigue, rashes that come and go. And what do we do with those patients? A lot of patients have suffered mental health problems as well and had quite significant post-traumatic episodes. So what are we doing with those patients? So clinical testing certainly is not always needed, but can help pinpoint causes of continuing symptom. But what's really important is you to exclude other things like myocarditis. Does this patient have a PE? So do they need blood tests? Are we thinking they've had COVID, but actually now they've got heart failure and it's just coincidental, they've got breathlessness. So we're doing BNPs. So, and these are the kind of here in this box at the top corner talks about what tests you should be doing and what's recommended to do. Certainly with D-dimer, if we think somebody needs a D-dimer, should we be sending them to ambulatory care? The boxes at the bottom talk about mental health, which is quite significant in these patients. Who do they need to be referred to? Do we have appropriate services? Do they need to go to the COVID, post-COVID advice line, which we have in NCL? What sort of safety netting do we need to do for these patients? So if we're suspecting a PE, if we're thinking about something cardiological, or is it we're thinking about something neurological, do they need rehab, those kind of things. So I'll share this slide with you so you can have a look at it in your own time. And I think it's worth sharing with colleagues and practices to have a think about how we manage post-COVID patients, because I certainly have noticed, so we're not seeing COVID cases anymore, but we're seeing post-COVID problems now in primary care. So I'm going to stop there for this morning, and I'm going to take any questions anyone's got, and if anyone wants to ask me anything about, certainly about services or anything that's going on. The final thing I did want to just make you aware of is that some of you might have received an email this week from the Royal Free about reviewing ultrasound scans that we have requested some months ago, and some information came out in the bulletin about that. This is being worked through with NCL and the LMC and the clinical directors of the PCNs to come up with a solution. So if you have received such an email from the Royal Free, you can decide to put that email on hold at the moment while it's being worked through and a decision is being made, so that primary care is being protected and not being burdened with workload. That's not been agreed. So if you do receive that email, just put it on hold for the time being. If you've got anything you want to ask me, please pop it in the chat bar, and otherwise have a great week, and I'll see everyone on Friday morning at the same time. Okay, everyone, thanks very much.